First, I would like to ask you permission to use this video for educational purpose.
Yes, you may.
You're my patient, right?
I'm your patient.
But we are not in the hospital.
No, you impressed me, and I love to be impressed.
Well, how did I impress you?
The first time I saw you, I don't want to insult you, but I wasn't impressed.
Oh, good.
And then I realized you went back and did everything I had done to me because you had to get to the insurance company.
Yeah.
And at that point, then I'm like, oh, now I got this guy. And did my neck. And I was back to work in not a lot of time because I could wear a neck brace.
When was that?
222 at 22.
Okay. Wow, that's a round number.
It's easy to remember. My son was born on 222 at 82.
Yeah, yeah.
So on the 19th, my older son and I, the one farms with me, jumped in his pickup. We went down. He had a 40th birthday party in Springfield, Illinois.
No, okay.
I got home the next morning. I had to get up to Crookston because I was scheduled for Alexandria and COVID closed them up.
Oh yeah, well, that was a bad time for everybody.
So I went to Crookston the same way I did today.
Yeah,
Or yesterday. I drove myself up and then sent somebody up and
yeah.
bring me home.
Now, if a spine surgeon look at you, they cannot wrap their head around that you had a multi-level spinal fusion to the morning.
Absolutely. I don't understand it. At 2 o'clock today, I could not believe I was even asked to think about going as bad as the pain was.
Yeah,
And then we got that under control.
yeah. So you got a multi-level fusion just a few hours ago. How do you feel? Honestly, how do you feel?
I have a little pain, but I feel very good.
Now, before the surgery, did you have leg pain?
I had leg pain for 15 years down my leg.
How is it now? How is the leg pain?
Well, I won't comment yet because I want to see what happens when my pain is gone in my
Absolutely, absolutely. Now, we actually, I usually keep patient over the night in the hospital, but we have a very peculiar situation. We had 8 patients that are in the ER waiting to be taken care of, and you were so nice, because you were cleared by the physical therapy and so on, and you were willing, because you were medically you could, but now you gave your bed to somebody who's really in a peculiar situation, need help. So I really thank you for that. Helping us to take care of other patients. But so that's why we are right now in a restaurant because I'm going to drop you in a hotel.
I am so very impressed, okay?
Well, thank you so much. Now, I'm impressed that you're willing to do that. That's important to take care of the other patient. But I think what the other surgeon cannot wrap their head around is that after multi-level fusion, by the way, you have a 2-level fusion. Your surgery was 45 minutes and our blood loss was 50 cc. 50 cc is about less than 2 ounces.
Right.
And the reason my patients are able to go home is because we don't spend 10 hours to just cause damage to their spine and surrounding tissue. Now it's still going to be a healing process involved, but you have walked in the hospital. Did you walk?
Yes.
Since the surgery?
Yes.
How did that go?
They wanted me to walk at 1 o'clock. And I was in so much pain. My knees hurt, my top of my legs and my knees. I'm assuming there was some playing around with nerves in my back, which you warned me.
Yes, it is.
And my back hurt. And
I did show you the picture of your back inside, right?
yes. And then that was a physical therapist come at 1 o'clock.
Yeah.
And then later, about 3 o'clock, the occupational therapist come. And he was totally amazing.
Yeah, good.
And about that time, I had to go to the bathroom, so he helped me.
Did they show you some tricks about what to do and what not to do? Did they show you some tricks like getting into the bed, getting out of the bed and so on?
I've been there, done this before with my back problem. I put my arm down and pushed myself up, put my legs down. He's like, okay, I guess this is going to go quickly.
Yeah. Well, I wanted to thank you, first of all, for, that helping us to take care of other patients, but as well thank you for this testimonial. Okay, I'm really happy that everything is working out well for you. We will see you in a few weeks. In that time frame, did you get a booklet that tells you about the limitation and post-operative care? Good.
Yes.
Do me a favor, read it tonight. Okay?
No, or tomorrow night.
Or tomorrow night.
I may sleep tonight.
Yeah. Well, thank you so much. I really appreciate it.
Okay.